If you or someone living with you is HIV positive, you should know how important it is to always take your antiretroviral therapy. Missing your antiretroviral therapy not only leads to drug resistance but also leads to treatment failures. But you don't have anything to worry. In today's video, I'll be guiding you through practical strategies on how to stay consistent with your antiretroviral medication. I am Esther Akawe Ugbo. You can call me your personal counselor. I'm a physiologist and also HIV prevention care and support officer with over 6 years experience working both in the hospital and in the community. So if you are new on this channel, you are welcome. And on this channel, we discuss everything about awareness on how to stop stigmatization on HIV. We also discuss faith and lifestyle. So let's dive into it. But no, before we go into the practical strategies on how to stay consistent with your antiretroviral therapy, let's even talk about why it's important to always take your antiretroviral therapy. Why is it important to take your medication? One, it's important to always take your medication because it helps reduce the HIV in the body. When you consistently take your antiretroviral therapy, which is your medication, it helps reduce the viral load in the body. And secondly also, it also helps to build your immune system because we already know that on acquiring this HIV virus, your immune system is already compromised. So the more you take this antiretroviral therapy, it helps you build your immune system to take up the shape and the strength to be able to fight infection, not just the HIV, but other infections and diseases that might come around. Thirdly, the more we take antiretroviral therapy, it helps reduce the risk of transmission. That is to say, it helps keep people around you safe. It helps keep your family safe, your friends safe, and it helps reduce the rate of transmission. And also, when you consistently take your antiretroviral medication, it also helps you reduce drug resistance, also help you reduce drug failure. That is to say, to enable the drug to work effectively for the virus which you are taking it for. So let's dive into the topic for the day, which is the practical strategy on how to stay consistent with antiretroviral medication. So the number one strategy we have here is setting reminders. If you are someone that is always missing the time for your antiretroviral therapy, you can set reminders. Set reminders with your watch, set reminders with clock, set reminders on your phone to help you to keep you updated on the time to take this antiretroviral therapy. And also, you can also tell your family, your friends, accountable family and friends, people that you can hold accountable. Tell them to help you set reminders if you cannot do it on your own. They should help you set reminders some minutes to the time you are going to take the drug so that you will not miss the time. So setting reminders also can help you stay consistent to your antiretroviral therapy. Another strategy is linking the timing for your antiretroviral therapy to the daily activities you have for the day. For instance, if you have a particular TV show and the TV show is consistent at this particular time, you know the TV show will always come up. You can also link the time, you can also link your antiretroviral therapy to that time for that TV show, so that whenever you are settling and gathering your things to sit there and start watching your favorite TV show, you're also taking your drug at the same time. With that, you will not even forget to take your antiretroviral therapy. You can also link it to like maybe the time for your brushing. If you are someone that is always brushing every morning and in a particular time, you can link the timing for this your antiretroviral therapy to that time for your brushing. Some persons like me, I cannot sleep without brushing. Like you can also link your antiretroviral, someone that takes the drug in the evening. You can also link the time for your antiretroviral therapy to that particular time you are always brushing in the evening, so that whenever you are brushing, you always have reminder that you are supposed to take your drug when you are brushing. So when you link the drug intake and activities of the day, most times it's very difficult to forget because these activities you constantly do every day. So if you are doing them every day, you already know that the time you take your drug is always going, your antiretroviral therapy is always going the same time. With those times to do those things for the day, most times it's very difficult to forget. And also, you can also link the timing for your antiretroviral therapy to when you take your breakfast. You already know that before you go to school, before you go to work, you must take your breakfast, no matter how light the breakfast is. You can link the timing of your antiretroviral therapy to that time for your breakfast. You can also link it to that time of the dinner. So just find something you know you do consistently every day and link that antiretroviral timing to that. It will help you stay consistent. This second strategy works very, very well. It helps you stay consistent to your antiretroviral therapy. Another strategy we'll be discussing today is pill organizers. We have this container that you can organize your antiretroviral therapy for one straight week, and it's always coming in days of the week. You have Monday, you have Tuesday through Sunday, and you also have space for morning and evening. So you can also organize your drug for a straight one week. With that, when you pick your drug for the first day, your mind will always remind you that you're also supposed to take the second one. So you don't need to start looking for where you kept your drug and where your drug. You've already arranged it for the week. Even when you are in a rush to go somewhere, in a rush to go to school, you're in a rush to go to work, you're in a rush to go for a meeting or something, because you already organized that your pill, it's easier for you to just pick, take, and go about your daily activities. Another strategy is always have a spare dose. For instance, you can always put your spare dose maybe in your car or in your bag. That bag that you know you are always carrying out whenever you are going out, or the car you are sure you are using for that week. You can always put a dose inside those places, and don't for this particular strategy, don't put more than one or two, because sometimes those places are not, the condition of those places are not always favorable for the drug. So you are putting one or two just for in case of emergency, not the whole drug, because it might reduce the efficiency of the drug. So just put one or two in case of emergency. Maybe you are rushing out to work, you are rushing out to school, and maybe you forget to take your drug at that time. You can easily, because you have extra dose in your bag, instead of coming back to the house, you can easily just take that extra and go about your daily activity. Another strategy is for you to plan ahead of your travel. You know, whenever you are traveling, you have to organize your bags, you organize your clothes, you organize your footwear, you organize everything you'll be using. Don't forget to organize your drug in the same process. Yes, as you're organizing your dress because you want to look good, because of the event you are going for, please also organize your drug. It's very, very important. Plan ahead of your travel. And if you plan spending 5 days for your trip, not stop you from putting like 6 pills inside your pill organizers, because you might end up staying more than those days you plan. So always plan ahead of your travel. Another strategy that works very, very well is getting support. Yes, getting support. Like in the hospital currently, we run this OTZ club for adult, but it's majorly for adolescents within the ages of 10 to 24 years. OTZ, it simply means Operation Triple Zero. It's a club whereby you bring adolescents that have been disclosed to together once in every week. It helps them acquaint themselves, and also help their self-esteem, because knowing that you have someone that is doing well, that is doing well, that is HIV positive, and you as a child seeing that person really doing well academically or in business, it helps you grow your self-esteem and helps you stay true to the drug and to the virus. So get support, because in most times it's always not easy to do this thing on your own. Get support, join clubs like that, both in the hospital, in the community. Some of these clubs are even online on social media. Join clubs like that to help you stay true to your medication. Also, some of these persons, they have WhatsApp groups that they work with. You can join those WhatsApp groups to help you. And those WhatsApp groups, there's one WhatsApp group I saw in the hospital. One of the adolescents is the one in charge of that WhatsApp group. What she does is they've already organized themselves based on the time they take their drug. Set of persons that takes drug in the morning, and set of persons that takes drug in the evening. So she's like the social media manager for that WhatsApp group. What she does is whenever there's this particular time, she sets alarm, like she drops a message on the group that but they don't use the normal words that anybody can just pick the phone and understand what they are saying. They have coded words. They use coded words to explain themselves, and it's really, really good. It's really recommendable. When I saw it, I really commended them for that. So what they do is, when it's time to take that particular drug, let me say for example 8 o'clock, they will write something. Hope you are going to school today. Don't forget to carry your lunch box alongside. So the lunch box is actually the drug itself. So they use coded words so that anybody cannot just pick their phone and understand what they are saying. And it's really, really nice. So you can actually join groups like that. Another way, you can also talk to healthcare personnel, like discuss with them on how to manage your timing and your antiretroviral therapy. They can also help you with that. And like I said, always have a support system. Always have a support system. Somebody you can always hold accountable. It can be your treatment partner. That's why most times when they come to the hospital, always encourage them, both old and young, to have a treatment partner. Treatment partner is not just there for the name. Treatment partner help to remind you for your drug time. Sometimes if you are very busy or you're out of town and cannot come and pick your drug, they can help you pick your drug and wait it. All these ones are strategies so that you don't end up missing your medication at any point. So with all these strategies we've analyzed, what happens if you actually miss your drug? With all these strategies, over 5 strategies that we listed earlier, what if you actually miss the time? What do you do? For instance, you miss your drug time few minutes after. You can as well go back and take it. If it's still within the same time, maybe just you missed it a few minutes after, you can go back and take your drug. Then also, what will happen if you totally miss for that day and the next day you remember that you missed your drug? What do you do? Forget the one that you've missed and take the one for that time. There is no need of overdosing yourself. Because you want to meet up time, you are taking the one you missed yesterday and the one you missed today, you are taking them together. It is totally wrong to do that. Forget about the one you missed and take the one for that time. And also, if you notice that you are consistently missing it, even with the strategy we earlier mentioned, you've actually tried some of those strategies and you are still missing it, talk to your healthcare practitioner, talk to your healthcare person or the doctor in the hospital. Maybe the timing is not favorable for you. Speak with the doctor or the healthcare person so that they can adjust the drug time for you and see how it can come into your activities of the day, how the plan can favor you so that you can stay true to your drug. Taking your medication as an HIV positive person is the best thing that can happen to you so that you'll be able to live healthily and live long, to be able to carry out your activities for the day and not unnecessarily fall sick or fall victim of one thing or the other. If you found this video helpful, don't forget to give us a thumbs up. Don't forget to share this video mostly to adolescents or persons that are still struggling with their drug timing. Share to them because this video might be helpful for them. And also, most importantly, don't forget to subscribe to our YouTube channel so that we'll continue to bring healthy tips on how to increase awareness and reduce stigmatization as far as HIV is concerned. Until our next video, stay true to your drug, stay true to your medication. Don't forget, education is power, and with the right knowledge, we'll be able to overcome stigmatization and stay true to medication. Bye bye.